Well, lung cancer is the leading cause of cancer-related death in Illinois. It's also the third most common form of cancer in the state, according to data from the Illinois Health Department. A recent report from the American Lung Association also found that black men and women are diagnosed at higher rates. So joining me now are John Anderson III, a lung cancer survivor, and Christina Hamilton, who is the Director of Advocacy for the American Lung Association right here in Illinois. Thanks so much for being with me this morning.
Thank you for having us.
John, can you describe, I know you were diagnosed in 2013, correct?
Yes, ma'am.
Can you describe the moment you found out that you had lung cancer and what the subsequent, fight against it was?
Well, the moment I found out I had it was so rare. I had what they call ROS1, which is a unique lung cancer, and I couldn't believe it because I was in great physical condition. And I'm I had a shoulder injury, so when I'm having a CT scan in my left lung, they saw a tennis ball-sized mass. So it was so aggressive. Through the biopsy, I had to have my left lung removed. Pretty much 4 days after the biopsy came.
So you had no symptoms or anything, really?
I had a little bit of phlegm, and that was it.
Wow.
And that's the part about you. Okay, I'm sorry. And that's the main thing about getting screened, is that I was healthy. I had great health insurance, but because being a man and being the keeper of the house, I thought it was just a cold. But I went and had this shoulder looked at, found I had the mass in my lung. Okay, to make my long story short, I ended up going through chemotherapy to no avail. One medication, no avail. But also my oncologist sent my specimen in and had what they call ROS1 cancer. Come to find out it was a medicine that could take care of my cancer, and pretty much it's been eradicated since 2015.
That's amazing.
And I've been going for. But the important thing is, just because you think you're healthy and everything else, if you're at that certain age, please go get screened.
Were you a smoker?
No, ma'am. When I was a young man in my 20s.
Right.
And I was 50.
Right. So you're decades later. You're thinking, well, okay, so far so good.
You never know.
Christina, I want to ask you, what kind of impact does lung cancer have right here in the Chicago area?
So unfortunately, lung cancer is the leading cause of cancer deaths in the Chicago area, Illinois, and nationwide. We are seeing disproportionate rates amongst Black Americans.
Why is that? Do you know?
Well, there's a number of reasons. Primarily, it's screening. The screening rates are only 17% in Illinois, so we really need people to understand screening guidelines, talk to their doctor if they think they're at risk for lung cancer. There's more risk factors than smoking: environmental exposures, genetics, family history. So if people are experiencing symptoms, something doesn't feel right, they should talk to their doctor about getting screened, because early detection really does save lives.
Outside of maybe going to a doctor, and we know that, access to medical care is also an issue in Black and brown communities. So what other help is available for people who might not, be aware that it even exists?
Well, the Lung Association is working with the Illinois Department of Public Health on an Illinois lung cancer screening initiative, and we have a free helpline that individuals can call if they have questions about the screening guidelines. They can support them with transportation, financial assistance, connect them to different support services, and that is really a valuable resource that we want more people to know about.
Yeah, that's important.
And there's also an email address, helplineinfo@lung.org, that they can contact to get more information.
So John, if you, it's wonderful that you've been cancer-free now for so many years, but if you had one message that you really wanted people to take away from this interview, what would that message be?
The importance of getting screened. The importance of, if you have something, go get it checked out. And also, too, mothers, daughters, sons, make sure your fathers, grandfathers, uncles are going, because unfortunately sometimes Black men, we tend to be a little bit too strong, and we don't go until it's too late.
Maybe too proud.
And exactly. And also there are some discrepancies when it comes to health care, but that's a whole nother story.
That's a whole other conversation.
Yes, ma'am.
Sure,
but the important thing is make sure you get screened, and don't ever think something's not nothing. Better safe than sorry, because it's you and your family that's involved in this decision.
I always like to say knowledge is power, about pretty much everything, right? So, well, John Anderson III, Christina Hamilton, thank you so much for joining me this morning to talk about this really very important health subject. I really appreciate that.
Thank you for having us.
And you can learn more about lung cancer and your risks on the American Lung Association's website.